Hi everyone, welcome to SimplyMed Learning. This is Hiba, Radiography faculty from SimplyMed. So today I am going to discuss equation-based calculation MCQs that have been repeatedly asked in various GCC licensing examinations like DHA, MOH, QCHP, SCFHS and Kuwait prometric radiographer examinations. As you already know, radiography includes several calculation-based concepts like inverse square law, grid ratio calculations, and many more. However, I want to clarify one thing at the beginning. I'm not going to cover every equation in radiography. The aim of this session is specific to prepare you exactly for the licensing examinations. So, we are only going to focus on those questions that have been repeatedly asked in our licensing examinations. Okay. Alright, let's get started. The first question we are going to discuss is from nuclear medicine. Interesting, right? For our radiographer licensing exams, you can always expect a few questions from nuclear medicine department also. Okay. So, the question is, a sample of technetium-99 has an initial activity of 120 millibecquerel. If its half-life is 6 hours, how much activity will remain after 18 hours? So you can see that the question is based on half-life calculation. So before we solve the question, let me just clarify the concept for you. So what exactly is this half-life? What is meant by this physical half-life? So half-life means, half-life is the time taken for a radioactive substance to decay into half of its original activity. Okay, as simple as that. Suppose I have some 100 millicurie of one radioactive substance. Okay, let's say like its half-life is 1 day. Okay, so after 1 day, how much will be left with me? 50 millicurie. Okay, if it's been 2 days, then how much will be left? Now half of 50 is 25. Okay, so with every half-life passing, the initial quantity will get half of it. Okay, that is the concept. So physical half-life is the time taken for a radioactive substance to decay into half of the original quantity. Okay, now that you have got the concept, we can go back to our question. So here it is given that a sample of technetium-99, it has initial activity 120 millibecquerel. So that is the initial quantity, and the half-life of this element is 6 hours. Okay, it means that after 6 hours, the initial quantity will have been reduced to half of it. Okay. Now we need to find out how much will be remaining after 18 hours. Okay. So in order to solve this, we have an equation. We call it radioactivity disintegration equation, radioactivity decay equation, or half-life equation. So the equation is AT is equal to A0 into 1 by 2 raised to T by T half. Now when first looking at this equation, it could feel like a complex equation, but once you practice it enough, it will become easier for you. Let me break down the variables for you. So the first thing, AT. AT means how much activity remains after a time period T. Okay, which is exactly what we have to find here. The question was set, right? Activity remaining after 18 hours. So that is AT. Now A0 or A naught is the initial activity. Okay, so initial activity here is 120 millibecquerel. So 120 into 1 by 2 to the power of T by T half. Now here the small t is the time taken. Okay, here the time taken is 18 hours divided by T half is half-life. Half-life is given as 6. So now we've got the equation. Now we can solve it. So 120 into 1 by 2 raised to 18 by 6 is 18 by 6 is 3, right? Let's solve it further. 120 into 1 to the power of 3 is 1 only. How many times we multiply 1 with 1? It will end up 1 only. Okay. So 1 into 3, 1 raised to 3 is 1. Now 2 to the power of 3 is 2 into 2 into 2 is 8. Okay. So 120 into 1 by 8. 120 by 8, which is equal to 15. Okay. So do we have an option 15? Yes, the first option itself. So this is how we solve this equation. Okay. Now to make you more thorough with this, let's practice two more. So the next question is, a radioactive isotope has a half-life of 2 days. If the initial activity is 320 millicurie, how much activity will remain after 8 days? Okay. So initial activity is given, half-life is given, time taken is also given. So now let's put it into our equation. Remember our equation was AT is equal to A naught into 1 by 2 to the power of T by T half. Now initial activity is how much? 320 millibecquerel into 1 by 2 small t. The time taken is 8 days. So 8 divided by half life is 2 days. So that gives us 320 into 8 by 2 is 4, right? So 1 by 2 raised to 4. 1 raised to 4 is 1. 2 raised to 4 is how much? 2 into 2 into 2 is 8 into 2 is 16. So 1 by 16. So 320 by 16 is 20. Okay. So yeah, we've got the answer option C. Okay. So I hope now it's a little more clear to you. Let's see one more. Now this one is a very important question for everyone who's preparing for this DHA Saudi Qatar examinations. Okay, this is very commonly repeated question. So yeah, let's read it. A radiopharmaceutical sample has an initial activity of 180 millibecquerel and its half-life is 6 hours. What will be the remaining activity of the sample after 2 days? Okay, so initial activity is 180, half-life is 6 hours and the time taken is 2 days. So here a common mistake that we'll do is we'll just directly put the values to our equation. But the thing is, see, half-life is given in hours and time taken is given in days. In order to solve an equation, we have to make the units of same quantity as same. Okay, here time is given in hours one and days in the other thing. So we have to convert this days into hours. Okay, 2 days means 48 hours. Now we can solve the equation. Okay, our equation was AT equal to A naught into 1 by 2 raised to T by T half. Now initial activity A0 is equal to 180. 180 into 1 by 2 to the power of small t is, how much is the time taken? 2 days, which is 48 hours, divided by, what is the half life? 6 hours. Now 48 by 6 is equal to 8. Okay, so 180 into 1 raised to 8 is 1. 2 raised to 8 is how much? 2 raised to 4 was 16. 2 raised to 8 will be 256. Okay, so 180 by 256. You'll be having a calculator, a simple calculator on your screen while you appear for your exam. Okay, so don't worry about finding out this. Okay, you can easily calculate. So 180 by 256 is equal to 0.7. Okay, so that's how we solve this one. Okay. Now let's practice one last question from this equation. Fourth question is, a vial contains an unidentified radionuclide with an initial activity of 60 millicurie at 6 p.m. Sunday. At 6 a.m. Monday, the activity decayed to 7.5 millicurie. Which of the following is the physical half-life of the radionuclide in hours? Okay, so here the question is a little twisted. We were finding out the final activity till now, but here in this question, final activity is given, initial activity is given, time taken is also given. We have to find out the half-life. Okay, we can use the same equation itself. We just have to substitute the values. Okay, it is equal to A naught into 1 by 2 raised to T by T half. Now here the final activity is how much? AT is equal to 7.5. 7.5 is equal to A0. Initial activity was 60 millicurie. So 60 into 1 by 2 raised to small t is how much? The time taken is 6 p.m. Sunday to 6 a.m. Monday. That means how many hours? 12 hours. Okay, so 12 by half-life is what we have to find out. So 12 by t half. Now in order to solve this equation, we can just rearrange the equation. Okay, we can bring the 7.5 to this side. So it will go as denominator. So 60 by 7.5 is equal to, we can take this 1 by 2 to the power of 12 by t half to the other side. So it is fraction, right? So it will flip. So 1 by 2 will become 2 by 1. So 2 raised to 12 by t half is equal to 60 by 7.5. Now 60 by 7.5 is equal to 8. Okay. In order to solve an equation with power, you have to make both sides of the equation as power. Okay. So 8, we know that it is power of 2. Right. 2 raised to 3 is equal to 8. Right. So now we've got that 2 raised to 12 by t half is equal to 2 raised to 3. That means 12 by t half is equal to 3. Okay. Then how much will be t half? T half will be equal to 12 by 3, which is 4. T half equal to 12 by 3, that is equal to 4. Okay. So that's how you calculate this half-life. Okay, so I hope it's clear. It might seem a little complex at the first time, but you will get familiar with it and it will become easier. Okay, so yeah, these are the questions that we have to find out using this equation. Now let's move on to the next type of questions that can come under this half-life concept itself. Okay, so let's see. Which of the following is its effective half-life? If an isotope has a physical half-life of 18 hours and a biological half-life of 10 hours. So, before we solve this one, let's just revise the term. So, see, here there is effective half-life, physical half-life and biological half-life. So, physical half-life we know, physical half-life is the time taken for a radioactive substance to decay to half of it. Now, what is biological half-life and effective half-life? Biological half-life means, suppose we are giving this radiopharmaceutical to a living being. Okay. So once it is inside the let's say like we are giving it to a patient. Okay. So once the radiopharmaceutical has reached the patient's body, the time taken for that radiopharmaceutical to excrete half of it from the patient's body, that is called biological half-life. Okay, the time taken for the radioactive material to get half of it eliminated from the system of the being is called biological half-life. What it shows us is how fast it gets eliminated from the person's body. Okay, so that's biological half-life. And effective half-life is the combined half-life from both of these. Okay, so now let's see how we can solve this question. So we have been given the physical half-life as 18 hours and biological half-life as 10 hours. Now we have to find out the effective half-life. So to find out the effective half-life, we have an equation. Effective half-life is equal to biological half-life into physical half-life divided by biological half-life plus physical half-life. Okay. So yeah, it's given here. So now let's substitute the values. So T effective is equal to, what is our physical half-life? 18. So physical half-life into biological half-life is 10 divided by physical half-life plus biological half-life. So 18 into 10 is 180, 18 plus 10 is 28, that will give us 6.4. Okay. So this one is rather simpler calculation than the first one, right? So this is how we find out the effective half-life. Now let's just practice two more from the same equation. Let's say a radionuclide with a physical half-life of 10 days is taken up by the liver and eliminated within a biological half-life of 15 days. Which of the following is its effective half-life? So what was our equation? T effective is equal to T physical into T biological divided by T physical plus T biological. So let's give the values. Physical half-life is 10 days and biological half-life is 15 days. So 10 into 15 divided by 10 plus 15. 10 into 15 is 150. 10 plus 15 is 25. So we will get 150 by 25 is 6. Okay. So that's the answer, option C. Now let's discuss one more and wind up this equation. Next one. Which of the following is its effective half-life of an isotope if the physical half-life is 3 days and biological half-life is 2 days? So let's put it in our equation. T effective is equal to T physical into T biological divided by T physical plus T biological. So now physical half-life is 3, biological is 2. So 3 into 2 divided by 3 plus 2, which will give us 6 by 5. That is equal to 1.2. Okay. So I hope now this equation is thorough for you. It's simple, right? So you should know these equations because these are some questions that you can definitely bag your marks. Now let's go to our next concept. So next calculation based question is from fluoroscopy. Okay. Which of the following is the approximate skin dose for a 5 minutes fluoroscopy exposure performed at 1.2 mA? So we have been given the time and the current used for a fluoroscopy procedure. We have to find out the skin dose. So we have an NCRP guideline that recommends the maximum skin dose from a fluoroscopy exposure should be within 2 rad per minute per mA. That means for 1 minute for 1 mA the maximum skin dose should be 2 rad. Okay. So we can just substitute from the question. Okay. So for 1 mA it is 2 rad. So for 1.2 mA how much will it be? It will be 2.4 rad. Now this is for 1 minute, right? So for 1 minute now it is 2.4 rad. So for 5 minutes how much it will be? 5 into 2.4 which is equal to 12. Okay. So this is how we can find out. If you don't get the concept, what you can do, just multiply the time and current with 2. Then also you will get the answer. Okay. So yeah, that's the way to find out. Now let's go to the next question, which is inverse square law based. Now this is a must know MCQ for everyone preparing for this any competitive exam. Okay. So let's see. The exposure rate to a body 4 feet from a source of radiation is 60 Roentgen per hour. What distance from the source would be necessary to decrease the exposure to 6 Roentgen per hour? So we have to find out the distance here. Okay. Before we go to the equation part, let me clarify the concept for you. Okay. What exactly does this inverse square law mean? So in the name itself there is something, right? Inverse square law. So the relation here is inverse. Inverse means opposite. Okay. And square. So let's see how that name came. Suppose there is a radioactive source here and there is a guy standing here. Okay. So now this person was initially at, let's say, some distance. Okay. Let's say it was 10 meter. Okay. So he'll be receiving some exposure, some dose he'll be receiving from the radiation source, right? Let's say he was receiving some 20 Roentgen per hour. Okay. Now suppose the person moved from this distance to double of it. He moved to here. Okay. So now the distance is double. Okay. So if the distance is doubled, what will happen? Will the exposure, will the dose be increased or decreased? Definitely decreased, right? As we move farther from the radiation source, the dose will be reduced. That is why the name inverse, okay? Because the one, when we are increasing one thing, the other quantity is decreasing, okay? So it's an inverse relation. And it is not just linearly decreasing. See, first the person was having some 20 Rontgen. Now if this person has increased the distance to twice of the earlier, right? So don't think that now the radiation exposure will be half of the first value, like 10. No. How much will be the new value, new radiation exposure? It will reduce to square times of how much we increased. How much we increased here? 2 times, right? We doubled the distance. 10 was doubled to 20. So 2 times we increased. So now the radiation exposure will be reduced to square of this 2, okay? That means 20 by 2 square, that is 20 by 4, which will be 5. So when the person increased the distance from 10 meter to 20 meter, his radiation exposure reduced from 20 to 5, okay? So that is what this inverse square law means. Suppose if I'm increasing this patient's distance 3 times of the original, let's say now he's standing at 30 meter, what will happen? The radiation exposure will be reduced to square of 3 now, 10 by 3 square, that is 10 by 9. So I think now you have an idea about this inverse square law. Now let's see how we can solve this question, okay? A body 4 feet from the source of radiation was 16 Rontgen per hour. Now we have to decrease the exposure to 6 Rontgen per hour. Okay. So to decrease from 16 Rontgen to 6 Rontgen, we'll definitely have to increase the distance. How much should be increased? So how can we find out that? We have an equation, that is inverse square law equation. The equation is I1 by I2 is equal to D2 by D1 whole square. Or we can write it as I1 D1 square equal to I2 D2 square. I prefer this one. This is easier to remember. Okay. So I1 D1 square is equal to I2 D2 square. Now let's substitute the value. I1 means the initial exposure, dose or intensity. So here the initial exposure was 16. So 16 into D1 square. D1 means first distance. First distance was 4. D1 square is 4 square. This is equal to I2 into D2 square. Now I2, the second exposure rate or dose or intensity, that is 6 Rontgen per hour. So 6 into D2 square. D2 is what we have to find out. Now 16 into 4 square is 16. So again 16. 16 into 16 is equal to 6 into D2 square. We can bring the 6 here. 16 into 16 is 256. 256 by 6 is equal to D2 square. So 256 by 6 is 42.666 something. This is equal to D2 square. So now we have found out D2 square. But what we need to find is D2, right? So to find D2, what we have to do? We have to take the square root of 42.66. That is equal to D2. So D2 is equal to square root of 42.66, which is almost approximately 6.5. It will come. That option is not in the question, but the value that is closer to it is 7 feet. So we can pick that one. Okay. So this is how we find out. Let's discuss one more question based on the inverse square law. The intensity of the X-ray beam at 1 meter from the source is 100 milliroentgen. What will be the intensity at 2 meters from the source? Okay. So we have to find out the intensity from the second distance. So what was our equation? I1 D1 square is equal to I2 D2 square. So here I1, the first intensity is how much? 100 milliroentgen. So 100 into first distance is 1 meter. So 1 square. This is equal to I2. I2 is what we have to find out. So I2 into D2 square. D2 is the second distance is how much? 2 meter, right? So 2 square. Now solving this, 100 into 1 square is 100 only. Then I2 into 2 square. 2 square is 4. Okay. So I2 into 4. Now we can keep the I2 here and bring the 4 to this side. So it goes downwards. So 100 by 4 is equal to I2, which is equal to 100 by 4 is equal to 25. Right. So our answer is 25 milliroentgen. Okay. We've got it right here. Okay. So either you can use the equation, and this question is very simple one actually, right? We can also calculate it in our mind also. See, the person was first standing at a distance of 1 meter. So at 1 meter, he was getting a intensity 100 milliroentgen. Okay. If he doubles the distance, if he's standing to 2 meter, means how much will be the exposure reducing to, from our concept inverse square law, if we double, the intensity will get reduced to 1 by square times of it, right? So here we have done it double. So square of 2, which is 1 by 2 square, which is 1 by 4. So 100 by 4. Okay. So like this also you can calculate if the question is very simple. Okay. So that's inverse square law based questions. I hope it is clear. This is a very common question for our GCC examinations, any competitive examination. Okay. So just remember the equation, I1 D1 square is equal to I2 D2 square. Okay. Now let's move on to the next type of calculation question. A radiograph was obtained with a grid ratio of 8 is to 1. If the grid is replaced with a 12 is to 1 ratio grid, what should be the MA's adjustment? If this one is related to our grid ratio calculation, the grid factor calculation. Okay. So before we go to that part, let me just summarize grid for you. So remember what is grid? Grid is used for absorbing the scatter radiation that might be reaching the image receptor. Okay. So for that we keep a grid. Grid will have many lead strips arranged inside it. Okay. Now grid ratio means the height of the grid divided by the distance between two lead strips. That is grid ratio, height by distance. Okay. So the thing is, if the grid ratio is higher, its performance will be better for sure. If the grid ratio is higher, more scatter radiation will be absorbed from that grid. But the thing is, along with the scatter radiation, the grid could also absorb some amount of primary radiation, the useful beam also. Okay, that is what we call grid cutoff. Okay, so in order to avoid the grid cutoff, what we do is we'll increase the MA a bit. Okay, so we can't just randomly increase the MA. There is a correct factor to how much we can increase the MA, how much we have to increase the MA. That is called grid conversion factor or simply grid factor. Okay. So if I'm changing a low ratio grid to high ratio grid, I will have to increase the MAs. How much I have to increase the MAs, that is called the grid factor. Okay. Now let's learn the grid factor for each grid. Okay. If there is no grid means the grid factor is 1. Now if we are introducing a 5 is to 1 grid, the grid factor is 2. Okay. If it is 6 is to 1, the grid factor is 3. 8 is to 1, grid factor is 4, 10 is to 1 and 12 is to 1, grid factor is 5, and for 16 is to 1, the grid factor is 6. Okay. You have to by heart this table, but as it is a linear table, it will be easy for you to remember. Okay. Now we have the equation to calculate the new MAs. Okay. We were given the initial grid ratio and the second grid ratio and initial MAs. Okay. So the equation here is old MAs divided by new MAs is equal to old grid factor divided by new grid factor. Okay. So the old MAs is, initial MAs was 50. The new MAs is what we have to find out. We can give it as X is equal to old grid factor. Old grid factor is, old grid was 8 is to 1 ratio grid. So 8 is to 1 grid factor is 4. So 4 by 12 is to 1 ratio grid is the new one. So the new grid factor is 12 is to 1 grid factor is 5. So 4 by 5. Okay. So 50 by x is equal to 4 by 5. We can isolate the x to this side. So that will be x will go to the upper side 50. This 5 will come to this side 50 into 5. This 4 will come downwards by 4. So 50 into 5 by 4. 250 by 4. 250 by 4 is equal to 62.5. Okay. So the new MAs should be 62.5. Okay. So I hope the equation is clear for you. Let's practice one more equation and finish this. An X-ray image was taken using 80 kVp and 32 MAs with a grid factor of 8. If the grid is removed, what should be the new MA setting to maintain the same image density? So, we have to find out the new MAs. Our equation is old MAs divided by new MAs is equal to old grid factor divided by new grid factor. So old MAs, the first MAs was 32, new MAs is x, old grid factor was 8. Here the grid factor itself was given in the question. If it was grid, we'll have to find out the grid factor. Since it is directly given the grid factor, we can write it as such. So the old grid factor is 8, new grid factor is, the grid is removed. So if there is no grid means the grid factor is 1. Okay. So 32 by x is equal to 8 by 1. We can replace it as, we can bring this 8 to this side. So 32 by 8 is equal to x can be taken to the other side is equal to x. So x is equal to 32 by 8 which is 4. Okay. So we got the answer. Okay. I hope it is clear now. This is also a simple equation, right? Okay. So that's about our grid factor calculation. Now let's go to the next question. Now this one is from our radiation quantities units, that part. Okay. The urinary bladder received an absorbed dose of 0.15 gray. The radiation weighting factor for the X-ray is 1 and the tissue weighting factor for the urinary bladder is 0.05. Which of the following is effective dose in C-word? So we have to find out the effective dose given that absorbed dose is 0.15 and radiation weighting factor, tissue weighting factors are given. Okay. We have an equation for that, but before that let me clarify this concepts, these quantities for you. What is absorbed dose? So suppose there is this human being and suppose we are giving some radiation to say some organ, whether it be liver or something. So the amount of energy that is deposited in the unit mass of this tissue is called absorbed dose. Okay. How much energy is deposited in that tissue? Okay. Now, we can't clearly say from this much, suppose this much energy is deposited inside me, this effect will happen. I can't completely say that from it. We need some more details to know what effect will happen. Okay. So, in order to find out that, what all we should know? Suppose there are two people. Okay. For both of them, I am using the same amount of energy. Okay. Let's say some 80 kV X-ray beam I am exposing them. But for one person I exposed the liver, for the other person I am exposing the spleen. Okay. Which is a lymphatic organ. So will both of this person be having the same effect? No, right? Because the radio sensitivity of these two organs are different. Okay. And suppose if I'm exposing them with the same energy to the same organ, but if I'm using different radiation, okay, for one person I'm giving X-ray, for the other person I'm giving alpha radiation or gamma radiation, will the effect be same? No, then also the effect will be different, right? So to know the effect, we should know how much energy is deposited and which tissue is getting exposed and also which radiation I'm using. Okay, so if I have all these quantities, I get effective dose. Okay, so effective dose tells us what, how much effect or what risk can I get from this. Okay, so to find out effective dose, you just have to multiply absorbed dose into tissue weighting factor into radiation weighting factor. So that's how we have to find out the effective dose. So the equation for effective dose is absorbed dose into radiation weighting factor into tissue weighting factor. Okay, sometimes instead of giving absorbed dose and radiation weighting factor, the collective of this would be given as equivalent dose. Equivalent dose means the organ dose. Okay, so yeah, we can find out from the question. So the absorbed dose given is 0.15. So 0.15 into radiation weighting factor is 1. Then tissue weighting factor of bladder is 0.05. Now when we multiply this, 15 into 5 and 4 decimal points. 15 into 5 is 75 and 4 decimal points, 0.0075. So when we look at the options, we can't find 0.0075. So what we can do, we can round this 0.75 to 1. Right. So that option is there. Okay. If the exact value is not in the options, round it to the approximate value. Okay. So this is how we find out effective dose. And the unit of effective dose is sievert. Let's do one more question from this part. A patient received about zero point 0.2 millisievert organ dose during a given chest X-ray exam. Which of the following is the most suitable effective dose if the lungs weighting factor is 0.12? So again we have to find out the effective dose. So our equation is effective dose is equal to organ dose into tissue weighting factor into radiation weighting factor. So here the organ dose is 0.2, then tissue weighting factor is 0.12 and X-ray weighting factor is 1. X-ray's weighting factor is always 1. Okay, so we'll get 0.2 into 0.12 which is equal to 2 into 12 is 24 and how many decimal points? 3 decimal points. So 0.024 millisievert. Okay, first option. Okay, so I hope now this equation is clear. Okay, now let's move on to the next type of question. So this one is, which of the following is the power injector rate in seconds if the technologist uses 100 ml of contrast medium injected in 40 seconds with 80 seconds scan delay. Okay, so in CT we give contrast, right? Using power injector we give the contrast. So in that we can select the specific amount of contrast, the time and flow rate, right? So the question is to find out the flow rate or power injector rate, which means the rate at which the contrast is going through the vein of the patient. Okay, the speed in essence. So to find out that, we have equation. So to find out the rate, the flow rate or the power injector rate, the equation is just divide the volume by time duration. Okay, so rate is equal to volume by duration. So let's see. So the rate is equal to the volume we are giving here is 100 ml divided by time duration. When looking for time, we see there are two times, 40 seconds and 80 seconds scan delay. So do we need the scan delay time? No, it is just to make our answer wrong. We only have to consider the time taken to inject the contrast medium, that is 40 seconds. So 100 by 40 is equal to 2.5 ml per second. Okay, so this is how we find out the flow rate. Okay, so to find out the flow rate, equation is flow rate is equal to volume by duration. Sometimes in the question the flow rate would have been given and the volume will also have been given. We'll have to find out within how much time, the time duration which was taken to inject this contrast. So what we can do, we can just rewrite the equation. Duration is equal to volume by rate. Okay, or if the duration and rate is given and we have to find out the volume, means just multiply. Okay, mostly this flow rate question will only ask, okay. So the equation is flow rate is equal to volume by time. If any other quantity asks, you just imagine this equation and rearrange, okay. I hope it's clear. Next question is also from CT. Which of the following is the total anatomy covered in millimeter? If a helical scan was performed with the parameters given below, okay. So we have to find out in a scan how much anatomy of the patient was covered. The parameters given are total acquisition time is 20 seconds, rotation time is zero point 0.5 second, that means the time taken for one rotation. Then slices per rotation is 4, slice thickness is 2.5 and pitch is 1.2. So the parameters are given. We have to find out the total anatomy covered in this. Okay. So for that we have an equation. The equation is total anatomy covered is equal to pitch into total acquisition time into slice thickness into slice per rotation divided by rotation time. Okay. So we have to just replace the values now. Pitch is equal to, pitch is 1.2. So 1.2 into total acquisition time is 20, total scan time was 20. Now slice thickness is 2.5, slice per rotation. The number of slices taken in one rotation is 4. Now divided all them by time for one rotation. Rotation time is 0.5. Okay. So this will give us 1.2 into 20 is 12 into 2, 24. Then 2.5 into 4 is 10. So that is 240. So 240 divided by zero point 0.5, which is equal to 480. Okay. So 480 millimeters are the covered area. Okay. So you will have to remember this equation. Just multiply everything, divide by rotation time. Okay. You will get the answer. Hope that's clear. Let's see the next one. Next question is, if a high voltage transformer has primary turns 100 and 50,000 secondary turns and is supplied by 220 volts and 100 amperes, what are the secondary voltage and current? Okay, so this equation is our transformer equation. Do you remember this transformer equation from our lower classes? Like in 8th or 9th, you would have learned this. So a transformer has a core and iron windings on both sides. If it is a step-up transformer, the number of windings will be less on the primary side and more on the secondary side. Okay. So here we have been given the number of turns in primary is 100 and secondary is 50,000. That means it's a step-up transformer. What does a step-up transformer do? It will increase the voltage. And it is supplied by 220 volts and 100 amperes in the primary side. We have to find out the secondary voltage and current. So for this we have the equation Vs by Vp equal to Ns by Np. That is to find out the voltage, and to find out current we have Ns by Np equal to, just inverse it, Ip by Is. Okay. So now let's substitute the values and find out the voltage and current in secondary. So the equation is Vs by Vp is equal to Ns by Np. Vs means the voltage in secondary, which we have to find out. Vp is the voltage in primary, which is equal to 220 volt. This is equal to Ns by Np. Ns means the number of turns in secondary, which is equal to 50,000. 50,000 divided by number of turns in primary is 100. Okay. So 0, 0 cut. Now we can just put the Vs on the left side. So Vs is equal to 500 into 220. 5 into 22 is 110, then 3 zeros. So 1,10,000 voltage is the secondary voltage. Okay. This we can write as 110 kV. Okay. So that is the secondary voltage. Now we also have to find out secondary current also. Now to find out the current in secondary, we can use the equation Ns by Np is equal to Ip by Is. So secondary turns is 50,000 divided by primary turns is 100. This is equal to Ip by Is. Primary the current is 100. So 100 by Is. Okay. Now 2020 cut and 2020 cut. So 5 is equal to 1 by Is, or we can write Is is equal to 1 by 5. 1 by 5 is 0.2. Okay. So 0.2 amperes. So if we look, we can see the option 110 kV here, and 0.2 amperes we can't find, but milliampere option is there. So 0.2 ampere can be converted into milliamperes. How can we convert 0.2 into 10 raised to 3 is milliamperes. Okay. 0.2 into 10 raised to 3. 0.2 into 1000 is how much? 200. So 200 milliampere. Okay. So we got the answer. Okay. So the equation is Vs by Vp equal to Ns by Np is equal to Ip by Is. Okay. Voltage is directly and current is inverse. Okay. So that's the transformer law. Let's see one more from the same type and make it thorough. So the second one is, if the primary coil of a high voltage transformer is supplied by 220 volts and it has 150 turns, and the secondary coil has 75,000 turns, what will be the voltage induced in the secondary coil? So now let's substitute in the value. Our equation was Vs by Vp is equal to Ns by Np. So Vs is what we have to find out, and Vp is the voltage in primary is 220. This is equal to Ns by Np. Number of turns in secondary is 75,000 divided by number of turns in primary is 150. So 0 cut. Now we can keep the Vs alone here. Vs is equal to 750 by 15 into 220. 750 by 15 is 50. So 50 into 220 is 110,000. Okay. 110,000, this can be written as 110 kV. Okay. So we got the answer 110 kV. Okay. So that's how we solve the transformer question. Okay. So I hope it is clear. We can go to the next one. Okay. Half value layer is used to reduce intensity of a radiation beam. Which of the following quantities of half value layer is used to reduce the intensity to less than 10% of original? So let me clarify you what is half value layer. Okay. Half value layer means, suppose there is an X-ray tube and X-ray beam is coming and we want to check the quality of this X-ray beam. So we are keeping a barrier on the path of this X-ray beam. Now the thickness of the barrier that should be kept to reduce the incoming X-ray beam's intensity to half of it. That is called half value layer, which means if I keep a half value layer on the path of an X-ray beam, the intensity of the X-ray beam will become half. Suppose if it was 100, after passing through this half value layer, it will become 50. Okay, that's it. Now the question is, how many half value layers should be placed so that the intensity reduces to less than 10%? Okay, so it's easy. Let's see. If I keep one half value layer, now the intensity will be reduced to half of it. It means it will be reduced to 50%. We are starting from 100%. So If I keep one half value layer, the intensity will be reduced to 50%. If I keep one more half value layer, it will be reduced to 25%. If I keep 3, it will be reduced to half of 25 is 12.5. If I keep a fourth half value layer, now the X-ray beam's intensity will be reduced to half of 12.5, which is equal to 6.2. So this is when the first time the intensity is reduced to less than 10%. So how many half value layer was needed for it? 4. Okay. So 4 is the answer. Okay. If I keep one more half value layer, if I keep a fifth half value layer, the intensity will be reduced to 3.1. If I keep 6, then 1.6. Like that it will keep on reducing. Okay. So that's half value layer. If an X-ray beam's half value layer is high, means its quality is good, its energy is high. Okay, it requires higher thickness to reduce its intensity to half of its original quantity. Okay. Yeah, that's it. This is rarely asked question, but it could come. Now let's look at the last question of the series. This is from MRI. Which of the following is the precession frequency of hydrogen at 1.5 Tesla magnetic field strength and gyromagnetic ratio of hydrogen being 42.57 megahertz per Tesla? So you know that our MRI is based on hydrogen protons, right? They will be spinning and we have to find out the frequency with which this hydrogen proton is spinning. Okay, so that frequency we call it precessional frequency or Larmor frequency. We denote it with the letter omega. So Larmor frequency is equal to gyromagnetic ratio into magnetic field strength B naught. Okay, so let's see. Omega is equal to gyromagnetic ratio of hydrogen is 42.57 into magnetic field strength used here is 1.5. So 1.5 into 42.5 is equal to 63.9. Okay, very simple, just multiply them. Okay, sometimes in question the gyromagnetic ratio wouldn't have been given. So you have to know that hydrogen's gyromagnetic ratio will always be 42.57. Okay. So with that we have come to the end of this session. I hope this class helped you understand the concepts behind this equation rather than just memorizing the equation. If you focus on the logic and the relationship between the terms, it will be easier for you to solve these questions. So these 20 questions that we discussed here, these are the most commonly repeated questions. These are very high yield MCQs that you have to be thorough with. Okay. So with that we can wind up today's session. I hope it's clear for you. If you have any doubt, you can reach out to Simply Med Learning. Thank you so much for watching this session. Keep practicing, stay consistent, and I'll see you in the next session.